Okay, in the jaw area, we have two fixed points. One of them is front, is the mandibular ligament. There is pirimasseteric ligament. How can I find the mandibular ligament? I hold the tissue and a little bit, when I move in the forward, you can see here is moving, but here is not moving. You can see here. Mm-hmm. This is the mandibular ligament, first fixed point of the lower part. And you can easily see where is the jaw sagging area. You can see here. And I can also do like this. You can see other fixed point here. And also around here, I can palpate the pulse of the facial artery. So facial artery and vein, they come together approximately here. They're coming in the deep tissues, okay? Because the layer anatomy is really important. They're coming in really deep tissues. It goes up and continue, usually, we can say 80% in nasolabial fold. And what is the first branch of the facial artery? We can say inferior labial artery, or, for example, yesterday in my cadaver I showed that there is two branch, labiomental artery. It can have some branches, okay? And there is another branch before the facial artery, submental artery, but it's underneath the mandible. So when you inject to the mandible, you cannot hit this artery. It's come in the front. And when we say this is the like midline, this artery, comes in the front and give the branch, and this branch is a little bit superficially. So it means it has both sides. It's not in the midline. It's approximately 0.6, but it can be changeable. But it's this artery, ascending mental artery, there in the chin area. But the level, it's getting more superficially. It's come really deep tissues, but in the chin area, this artery coming more superficially. Inside the muscle layer or a little bit superficially. What is our layers? Bone, I call it layer 5. Then deep fat tissue, it's layer 4. This is the non-mobile fat tissue. Then the muscle layer, we call it SMUS. This is all tissue has is the SMUS layer. From the forehead till chin. SMUS layer 3. Then the superficial fat tissue, this is the layer 2. SMUS layer means the muscle layer, which is moves with our mimics. If it's move, not underneath, the overall, above all tissues are moved with the muscle. It means the superficial fat layer 2 also moves with the muscle, and our skin is moved with the muscle. That's why we have mimics. When I move my muscles, you can see my mimics. My skin is moving with the muscle, and also between the skin and the muscle, the tissues are moving. So this is the facial artery. It goes up, and superior labial artery, the second branch. Then sometimes subalar artery. But I know that approximately after zygomaticus major muscle. Let me draw the muscles. What is this triangular muscle? DAO, depressor anguli oris, from the zygomatic commissure, or we can call it modiolus here. This muscle, zygomaticus major, smiling muscle. DAO means depressor, pull down, anguli, corner of the mouth, pull down. Okay? Mentalis, muscle here, pull up the chin. Okay? And then subalar artery goes up. It's called angular artery. There is also branch lateral nasal artery. Here in this area, in other artery comes here. What is this? Dorsal nasal artery. Its branch also here, supratrochlear artery. Then I feel with my finger supraorbital notch. This is approximately here. This is supraorbital artery. In the glabella area, there is also paramedian arteries. All these arteries, dorsal nasal artery, paramedian arteries, supratrochlear arteries, infraorbital arteries, this system is internal carotid system, which it means the system is also the end branches, but also the retinal artery is also the internal carotid system. So it means when I inject something inside this system with my filler, if I push fast with high pressure, my product can easily go backflow and block the retinal artery. But it can also happen in the external carotid system. Why? We have connection, anastomosis between the external carotid system and internal carotid system. Which area? You can see here, this is the facial artery, main blood supply of the face. This is external carotid system. Another external carotid system, it's coming in the hair area, superior temporal artery. It has branches frontal and parietal. Superior temporal artery, you can also palpate it. This artery is also external carotid system branch, and it goes approximately inferior border of the zygoma, transverse facial artery, and infraorbital artery. These arteries all external carotid system. But we have another artery, but it's not, I can feel the notch here. Zygomaticofacial artery. So, zygomaticofacial artery, supraorbital artery, supratrochlear artery, dorsal nasal artery. You can see my fingers, all internal carotid system. Don't forget, there is an internal carotid system here. Then, superior temporalis facialis, infraorbital artery, this, all, and transverse facial artery, my fingers, all external carotid system. But you can see here, internal, external carotid system. I broke my pen. Here is the anastomosis area. Here is the anastomosis area. Here is the anastomosis area. Okay? Usually in this area we have anastomosis. Then again, if I press too much with pressure, my product can also from the external carotid system through the anastomosis can easily pass a backflow through the internal carotid system and also can cause blindness. Let's talk about the layers again. What I said, it comes from the deep tissues. It's still deep. My first branch underneath the DAO. DAO is the mimic muscle, is the layer 3, which means my first branch lies underneath the muscle. It's still deep. Zygomaticus major muscle, my second branch still goes underneath the zygomaticus major and coming up and also superficial. It means around here my facial artery coming more superficially. So, and of course we have columellar arteries. Okay, usually they lie in the filtral columns. And we have two columellar arteries in filtral column, superficially and deep. That's why the filtral column directly with needle injections can cause also vascular complications. Be careful. It has also deep and superficial columellar arteries. Did I forget something for arteries? No, I think these are. You have questions or something? Do you want to add something which I forgot something?
Yeah, you're still going to talk about the vein. Yeah.
This is the arteries. Let's talk about the veins. Of course, the veins are less important as the arteries when you compare it, but also its vascular complication can cause like a cavernous thrombosis in some cases. Facial vein comes with the artery. Usually it's laid from the mid-cheek groove and continue with the artery. Here is the angular vein. But some cases, facial artery can stay here, can have duplicated. One of them is here, and one artery can go with the vein or only in the mid-cheek groove. That means the line of mid-cheek groove is important, one of the safety line. It means above this line there is no facial artery, there is no facial vein. All is below. Okay? So I can say mid-face area, quite safe area, but don't forget zygomatic facial artery. But we have also some advantage with the needle injection, this area. Before the treatments, you can fill the notch. I can fill it. I can fill almost myself. And in this notch, the artery comes with vein and with nerve. Nerve is bigger, artery is smaller. It's hard to hit the artery, intra-artery injections. One of the advantages is this. The other advantage is the nerve is bigger and it's the sensitive nerve. Before you inject, before the lidocaine, when you touch with the bone or when you touch the nerve, super painful. It also warns you if it's too much pain when you directly with the needle injection to the deep in the mid-cheek area, the patient react. That's why it's also one of the advantages. But nowadays, I inject more in days. I inject cannula even in the deep tissues. Why? Because if I plan to inject also the superficial, I will use cannula. Why I don't start with the deep injections with the cannula? I do the first deep injections with the cannula. I change my layer, then continue with the superficial injection with the cannula. Then if I do the MLT3, then still the same cannula, go more superficially, then I can inject the red density one. But my plan, only in, for example, male patient comes just a little bit mid-face or the medial SUF injections, for example. I can also work with the needle because my plan only the deep injections. I don't need to open one cannula. I can also inject deep injections in this area needle. I don't know you use needle or not, but I like needle somehow, so I use needle also in the mid-face. No? You do? Yeah, good, of course. You can inject, for example, be careful where is the infraorbital bundle, I can say, because it also comes with the vein and nerves. Here is the orbital rim. Here is the mid-pupillary line, for example. Yes, here is the mid-pupillary line. Sorry. And our infraorbital nerve approximately 6 to 8 or maximum 10 millimeters. We can say the 1 centimeter below the rim, and it's medial to the mid-pupillary line. We call it medial limbus, but your limits should be mid-pupillary line. I don't go more medially with my needle. I'm always lateral to the mid-pupillary line for my needle injection. So let's say how I find my for example, deep fat pads on the mid-face. Let's see. I told you this is my orbital rim. Okay, so my first drawings, I can say from the commissure, is the modiolus, to the zygoma. This is my zygomaticus major muscle. My second drawing is mid-cheek groove, my limits, my safety line, which the artery, vein, everything's here, okay? And then my third line from the lateral canthus, vertical line. Okay, then I can find my 3 deep fats. Non-mobile, deep fat of the midface, they are not mobile, they are not moving. Do you know our ligaments? This limit also the ligament orbital retaining ligament. In the zygoma, what is we have the ligament? Zygomaticocutaneous ligament. So between these 2 ligaments, we call this area perizygomatic space. And I know this vertical line divided my SUV. SUV means deep fat underneath the orbicularis oculi muscle, layer 3, orbicularis oculi. Underneath the orbicularis oculi, layer 4, deep fat. SUV means suborbicularis oculi fat. And this vertical line divided medial SUV and lateral SUV. Here is the medial SUV, here is the lateral SUV, and approximately the junction, because it's like this, it goes have the medial part, but here is the deep medial cheek fat pad. Here, medial, lateral, and the junction. Okay? These are my 3 deep fat pads. But we inject also, this is the like limit of the zygoma, but I don't only inject here. For the female patients, we can inject all the way in the zygoma because the lateral projections, it give us more heart-shaped appearance. And also I believe that around this limit, when you inject more laterally, it helps for the little bit lifting effect. That's why we inject. I don't do it for the male patient usually, sometimes, but usually for the female patient to create more heart shape. In the lower third, here is my jaw, for example. I told you between this ligament, here is the sagging, especially in the old patients. So my aim for the rejuvenation to hide this sagging. If it's, for example, goes down, my plan to give volume here and also to give a volume a little bit corner. I told you it helps for a little bit lifting effect. And I have lack of tissue in this fixed point, prejaw sulcus. My aim also to fill a little bit prejaw sulcus, and sometimes needed chin area. Okay, so chin injections, we can work deep fat, superficial fat, whatever. Deep injections, needle, cannula, whatever you want. Prejaw injections, deep needle, deep cannula, superficial cannula, whatever you want. Double layer you can inject. Corner of the mandible, you can inject deep, superficial, cannula, needle, doesn't matter. The point is important to find the facial artery. You cannot inject here and till mandibular ligament. In jaw sagging, it's also high volume because my aim is to hide it. So I don't need volume here. I need volume is more anterior and more posterior. And the second one is between these 2 points, the artery can be found. So deep injections with needle, it's forbidden in this area. This is the lower third area. Also marionette correction, you can entry from here to inject like fanning technique, or you can entry from here, you can inject like this to correct the marionette. But if you want to correct at the same time nasolabial fold and also marionette fold, this entry point it makes sense. You can go lower, you can go up, you can correct in the same time both nasolabial fold and the marionette line also. Mid-face, I told you, needle possible, cannula it's possible. For example, I can use this entry point, I can reach medial deep fat, deep cheek medial fat, lateral till zygoma, doesn't matter. You can enter from here, you can go deep fat and you can inject here, enter from here, you can reach everywhere, doesn't matter. The aim is not your entry point, the aim is you should reach every places with your cannula. and just change your layer, then you can inject superficial fat, because this is also the limits mid-cheek groove and nasolabial fold. This is the limit of nasolabial fat pad. Usually it's also increased by aging, but not for her. That's why usually in the superficial fat injections we do not inject nasolabial fat tissue. Above this line, this is the medial, middle and lateral temporal superficial fat. You can inject with your superficial fat injections with cannula. Temple area, here is the temple, upper border of the zygoma, lateral orbital rim and crests, temporal crest. Here is the temple area. I told you we can work as a gunshot technique. Also we can use subcutaneous injection, which artery is there. It's a little bit dangerous. And also we can inject intrafacial layer. Do you remember the layers of the temple? Let me remind. Deep is the bone. There is no deep fat, directly muscle, because it's not a mimic muscle, it's chewing muscle. That's why there is no deep fat tissue underneath the masseter. Masseter is also chewing muscle. And temporalis muscle, then deep fascia, then, innominate fascia, it's not so important, or we can say intrafacial space, superficial fascia, which artery is there, and subcutaneous tissue and the skin. So intrafacial, how I find intrafacial layer, you can both entry from lower part or upper part, but it's easy to find here. Why? Deep fascia in the temple area continues with the galea to the forehead. Superficial fascia is the SMAS layer of the temple. It continues with the frontalis muscle. If I in the crest area, if I open with my guide needle until the bone, until the galea, then I put my cannula until the galea, then I slide to the temple area, I open, touch the bone, then I slide to the temple area, I'm over the galea, then my cannula is directly over the deep fascia. It means intrafacial layer. Okay, this is easier. From here also I find sometimes, but it's not easy to find it. How I understand, because usually in the intrafacial layer, your cannula slides more easily. That's why I think I'm in the intrafacial, but it's hard to find from here. I think it's easy to explain from here. Forehead, I told you, when you go up, it's getting more dangerous because internal carotid system. Nose is one of the most dangerous area. And also the glabella is the highest blindness rate in the glabella area. This nose is the second. And forehead injections, deep is safe, we can say it. We can also inject with needle. We can also with cannula. Cannula is safer, of course. But there is also another safety line. This is the orbital rim level, approximately 2 centimeters up to the orbital rim level. It calls safety line. Why we call it safety line? All the vessels come from the infraorbital area, from the bone, going up, or is not horizontal, perpendicular, going up, and approximately 2 centimeter distance. They are coming from the deep tissues to the superficial layers. So in this area they are so deep, approximately to 2.5, they are getting more superficially. And here, this area, they are more superficially. You can also work with cannula, again, deep tissue, underneath the muscle, underneath this mass. Also, you can work with a needle, multiple point, but you have to be underneath the fat tissue, deep underneath it, above the supraperiosteal level. That's why if you inject with the needle, you have to be careful of the opening of the needle, because in the cadaver courses we just do the 90-degree injections. My dyed hyaluronic acid, it's even inside the subcutaneous tissue. That means in the layer of the vessels. But when I touch the bone, then the bevel down, the opening of the needle just over the bone, then my all dyed hyaluronic acid underneath the galea. We tried in the cadaver. So that's really important for head injections when you do with the needle. Cannula, it's easier. You can open from here entry points. Laterally, you can open your entry points. But don't forget, open your wave with the guide needle, touch the bone, then like doing bevel down, open also wave with underneath the galea. It's hard tissue. Then your cannula touch the bone, then you slide your cannula, then it's really tight tissue. You cannot even move your cannula within your injector. Yesterday I showed, when I put my cannula inside this tissue, when I left it free, my syringe stable. It's that tough and hard plane. So doesn't matter how many opening you open, but underneath this galea, the deep injections always safe in the forehead area.
Вы не делали ботулотоксин?
Вот доктор рекомендует вам с этого начинать.
If you want, I can show a little bit this frown lines also, RH1 with the blanching technique, huh? Because it's one of the afraid area. I can show it. So let's start with the temple. We have one advantage.
See everything.
I can see palpation. You see, of the artery. This is medium or large.
Это medium или большие? Там больше L надо.
Medium.
Okay, let's try.
It's
It's okay. It's okay. So, which part is your entry point? Do what you do. I will check.
Так,
Разметку сделайте себе. Откуда вы
Как бы я
будете?
начала.
Точка входа, да. She never worked with the upper face. She is good
okay.
with the middle and lower part, but not with the upper. It's the first
Okay,
one.
then I can show the one side if you want.
Is
I
it
can
okay?
do.
Sure.
It's okay. I can do one side. You can do other side if you want.
Он может одну сторону
так, сейчас
показать
можно
вам?
я скажу?
Yeah,
Как
she
правильно ли я
wants to show
делала?
you how she would do it.
Okay.
Да, получается, я когда корректировала, я не часто делала коррекцию височной зоны.
Но вы делали
но
раньше?
Я делала, да, буквально пару раз.
Just 2 times she did
Okay, good.
Височную зону. И я делала вкол, получается, вот с латеральной зоны, именно лобной.
Yeah. And the entrance point was the same like
Good.
recommend?
Здесь прям
Crest.
видно венки, да, я вот примерно...
Fill it the crest here.
Там есть гребень у нас.
Exactly.
Он
Be
рекомендует
careful.
с гребнем.
She has a thin skin and a light skin color. You can easily see the veins. Can you see it there also?
Да, примерно вот в этой
What
зоне
happened
я
if I
делала
touch the
прокол.
vein?
Может быть, немножко
Not
выше.
the big problems. The hematoma, yeah, and the bruising is not a big problem.
But not pleasant one.
I know, but I don't care. I'm surgeon, so I never care bruising. Dermatologists
We do
care
care.
a lot, I know, but I never care. When the patient asks me, it's bruising. So I said, okay, so what?
It is plasma therapy for present.
Yeah.
Exactly.
Extra effect.
Why not?
So, okay, so what happened? So, what do you want to say?
Я делала точку вкола. Может быть, не здесь, может быть, я делала чуть выше, может быть, в этой зоне я делала. И, получается, канюли заходила вот так вот.
Ну, вообще, если вы делаете именно с
I don't
гребнем,
go up because the
Yeah.
curve of the chair.
Да,
потому
если
что
с
если
гребня,
вы
там
зайдете
немножко
туда,
сложнее.
центрально, нет, потому что меняется изгиб, и канюле будет трудно
Да,
перейти.
да, тяжело
через
Exactly.
перейти.
Поэтому через гребень лучше всегда точка вкола, когда на самой выступающей части.
На
у
самой
вас переход.
выступающей, да?
Вы ее прям чувствуете, если 2 пальчика на гребень положите, вы чувствуете переход.
Хорошо.
Да, вот здесь вот, да, получается? Нам надо вот здесь вот
Вот
сделать
оно.
точку вкола. Мгм. Но мы же не можем пойти...
Нет, это гребень, вы
да,
выше.
гребень мы выше, получается, да,
How
делаем.
big the distance is from the eyebrow you recommend?
How I don't have any rules.
У него нет никаких правил, то есть высоту, точку.
Okay, this is, for example, I
Вот
can
я
say.
чувствую гребень, да, и получается...
И с него легче заходить.
С него легче заходить,
But
да?
yes,
Вот
perfect.
здесь вот.
But for example, this is a crest, huh? Stay a little bit back from the crest, and then check the veins. If, for example, here's the vein, here is the vein, and open your way from here. Okay? On the bone side, because the crest is a limit between the temple and the forehead. And this limit, all tissues, the temple layers, end up this crest. Muscle, other fascia, everything get together and they stick to this crest. And over it, it's the forehead. That's why stay in the forehead area, touch the bone, then you can go inside the tissues, all these temple tissues. So this is the limit. Be a little bit back from the limit and be careful over the veins. And your aim to fill here. Then check, can I reach everywhere with my canina or not? This is the targets. Okay. So you want to do lighter or not? Lidocaine. You
Будете
want to do
обезболивать точку вкола.
enter
Вообще
or
это
not?
сильно повышает комфортность процедуры. Но если сразу слой находится, тогда не больно.
Инфильтрационно, в смысле?
Да, просто
No, the entry point.
Ну, мы вообще не обезболиваем, но...
They never
окей.
use anesthetic.
Yeah, me too.
Тогда лучше не используйте, потому что вы
хорошо.
должны
Okay.
почувствовать вот эти все ощущения,
Окей.
которые пациент проходит.
Так.
Так.
Игла нужна, да, получается?
So where is the
Разметку
product?
убирать или нет?
Как вам угодно.
Разметку.
Which product we want to use?
Какой бы вы использовали препарат при коррекции этой конкретной
Височной
пациентки?
зоны?
Да.
Так. Но я думаю, слишком плотный препарат не нужно использовать, да?
Не нужно, да,
Да.
категорически.
Тиосяль может быть рачей 4 либо 3.
Я бы двойку взяла.
Двойку
What
даже?
What would you recommend to use?
Not 4, 3.
3.
I would choose 2. Be mindful.
2?
Yeah. Because it will be like really easy to resolve because she's too
10?
thin, yeah.
Let's do 2. Yeah.
Тонкая кожа, да? то,
Она
что-
вообще не будет вам... Вот всегда, когда есть сомнения, допустим, выбрать 3 или 4, выберите 3. Если 2 или 3, лучше 2. Потому что она потом голову...
I do
будет,
4
ну,
for
неправильно
regular
рассказывала.
patients. I do 4 with the interfacial layer.
Yeah, we just like to not hear the complaints after, so it's like really easy to adjust the tissue. But maybe it's like better to do the way you recommended. And why is the recommendation of 3? It's, better
Not
to-
4, 3, because it's
Yeah.
interfacial. It's not easy to see these irregularities.
Ну, сегодня главное доктор говорит, попробуем 3.
Окей. Так, а где у нас препараты?
Where's the products?
Yeah, just one second.
25. Don't use this, never.
27G очень тонкая.
Проекция у тройки будет выше, то есть если мы глубже его располагаем, то вот это выталкивание способность...
I never use 27 gauge cannula. Never. It's like needle. It's the same with needle.
Так, тут получается 50 миллиметров, 25G.
Да.
Подойдет 50 миллиметров?
Yes.
50, 25.
25.
25, окей.
Пока тройка.
Трака.
Сейчас мы ее отработаем, потом огнется она. Нужна 4, 2, наверное. Пока 2.
RH1, RH4, RH3.
RH1, RH4.
I think about 2, yeah? 2 syringes or 3.
Yeah, let's see.
Okay, because it's...
Эсок нету, да, перчаток? Эсок.
3 ты уже удали.
Одного хватит?
Ну пока посмотрим. Давайте, давайте.
Виктория, у вас эсок нет перчаток? Эски.
What is this?
It's a chlorhexidine. This anodidine is close to the one that you use, this the blue one. Держите.
Too big?
Yes.
What is tree? Tree in Russian? Tree. Tree.
Три.
Architri.
Yeah.
Architri. Adin. Adin two.
Один.
Один,
Один
two.
one.
Adin one. Two.
Два.
Два. Two. Два. Okay.
We like you here, so you should start to learn Russian.
Right? I should learn. It's hard language.
But you can speak Kazakh.
I
We
cannot.
asked you yesterday, is it easy for you to understand Kazakh? He said, I never heard Kazakh language.
Can you speak
around.
Kazakh?
No, me
No?
no, unfortunately not. But I believe that some doctors they can. Может быть, что-то скажете, он говорит, я не знаю, понимаю или нет казахский. Казахский.
Very good story. Yeah, this is the same.
Понимает.
So be careful for the veins.
This is
Yeah, this is a vein.
Он там задумал.
For example, you can open. I will show it. I think here, because or here. Here no, not vein. Here not vein. Touch the bone. Directly open the vein. It comes.
that's all.
Make like this to open. Yes, good. I think enough. Let's see. So thin tissues.
Yeah.
Let's see. Filled, primed. Okay. First 90 degree. You also touch the bone. You can like hold the tissue. If you touch the bone, then slide, go through the tissues. I think I can go a little bit. No, don't give it. Open your way until here. Is it slide easily or not?
Yes, easy.
Easy. Good. Then, okay.
That's
So
what I can
when I do like this, it looks like superficial, but
Feels.
it's not that superficial. I can feel it. It's thick. It's how you say hard
Yeah.
to move.
Он тяжело приподнимается.
Exactly. This is not subcutaneous. With this patient, if it's subcutaneous, it should be. You can directly see all details of the cannula. I can feel it. I think it's interfacial.
Yeah,
It looks like I feel it. Yep. Then inject really small amount, retrograde.
That's отметка.
Down.
Down.
Because all the danger is up, so give it down.
Okay.
Just a small amount. You should press. Did you inject?
Yes.
Okay, good. Then come again. Inject. Okay, when you go up, less inject because we don't want too much volume here. We want volume here.
Okay.
Don't go. Again, give more volume here. Perfect. Super. Here. Inject more. Perfect. Super. Here a little bit. You can see it's easily slide and not so painful. Can you see it? Yeah, do it. Perfect. Good. Control with your orbital rim. Don't pass the rim. And what I recommend, you can fill a little bit here also, between the zygoma and the temple. Fill a little bit here. Good. Perfect. Good job. She's doing good. Great. All good?
Good, good.
If it's correct layer, it's hard to also hit the veins for the hematoma, for the artery. It's kind of safe. We already gave 0.3, and superficial injections, less volume, better results. Gunshot technique, more product, less results. It's also
Expensive.
exactly.
Yeah. Like the male correction yesterday. Who can afford that in the clinic?
Exactly. Yeah, yeah. Just a little bit here. Super. Yes. I think. Just, yeah, exactly. Exactly.
Then you said that you do not see the need to correct.
Okay, go. Half. That's why I said go. Sorry, what you said? Sorry?
About the roof. There is no need to correct it.
It's not first choice because she has already, look. She doesn't need more. It's already high. This is rim. It's super high. It goes. We don't need this.
Yeah, but at this point. No.
This is the like temple area.
Yeah, but
This is temple.
yeah, just like the bone, like this angle of the bone.
No, no.
No.
Roof?
Нет, говорит,
Roof is here.
Хороший у нее рух, говорит.
Roof is here.
А вот эта латеральная точка, он говорит,
She
это
need here.
височная зона, он говорит, вот там можно, а сам руф не надо.
Look, even 3, we don't have some irregularities. It's good.
Yeah.
Массаж?
Yes, a little bit. Not so hard, like gentle. Nice. Good result.
Thank you.
Let's do what we're gonna do. The whole face one doctor
Все будем
or
делать. Вы одна будете делать все лицо, да?
we do like
One
this?
doctor and whole face.
Whole face. Okay, let's do the half. You do the injections. When you're doing the other half, we can start other
Yeah.
patients.
Когда будете вторую половину делать, мы начнем с второго пациента.
You can do it by yourself other side, okay? So, good. So, mid face. What do you recommend? Multi-layer.
Так. Латеральный лифтинг я бы хотела проработать. Так, здесь получается...
Yes, she also needs, again, exactly, the superficial fat injections here. But first, let's treat with the deep injections. A little bit medial SUV. She needs the volume support here. She doesn't need too much volume here, but yes, laterally deep injections to lift the tissues. Small volumes. Deep medial cheek fat also. She lack of tissue here. Medial, lateral to the lateral SUV, and deep medial cheek fat. Let's do it the deep injections first of all. Then we change. We do whole superficial fat with superficial injections.
Точка вкола, получается. Где бы я сделала, да? Если я хочу проработать именно зону средней трети лица, получается, да? Я бы сделала вот здесь вот вкол и вот так вот получается. Сюда бы меньше, сюда бы я практически не ложила препарат, потому что здесь малярный мешок, он потом начнет отекать, ну я так предполагаю. Вот, и проработала бы зону вот именно латерального лифтинга. Но я бы еще хотела проработать именно вот эту вот, получается, ямку.
Это уже поверхностно. Давайте сейчас мы с этим. Ага. Ну, в принципе, с этой точки вы тоже достанете. И дальше закончите, и я переведу доктору.
Угу. Ну, в принципе, все. Вот если бы я отсюда зашла, я бы проработала именно зону средней трети. Но вот эту часть я бы, конечно, не затрагивала, потому что здесь, получается, у нас носогубный жировой пакет. Да, получается, именно вот эта вот часть.
And she wants to correct from this point lateral and medial part of the face. And she also wants to correct the space under the zygoma.
Хотела, но сюда не тяжело будет зайти отсюда, и я думаю, что скорее всего...
Нет, не будет тяжело, нормально. Ну хорошо, да, можно менять. Вообще вколы можно делать столько, сколько вам нужно, не надо там с одной точки пытаться все это скорректировать. Надо поменять, поменяйте вкол. Yeah, she just like if she's going to correct this under zygoma space, then she wants to change the entrance.
Good. You can enter from here. You can do like this. You can enter from here. You can do like this. Both is okay.
Окей.
Perfect. 4. Арече.
4. I'm the bank.
I'm the bank.
Yeah.
Maybe after that we can also do just the contour for the lips.
Okay, you like that?
Look, there's no contour, not lip volume, because when you compare the face to lip is quite good.
Yeah.
Exactly.
Чуть-чуть только вверх.
But it's comparable, good lips, the volume when you compare with the face. But there is no contour. Just make contour. That's all.
Какой препарат стоит? Не помните? Где
You want or not?
Нет, не я делала.
И доктор предлагает сделать
25 coach. Can you do?
контур губ.
First.
Улучшить контур губ. Год назад у пациентки была коррекция, не помню, каким препаратом. Плохое сочетание у нас не дружит. Какие филлеры, знаете, с ячейкой в губах? Да? Жуйдерм. Они прямо вот не любят друг друга. When we combine it, it's like always like this.
You have Juvederm also?
We have on the market, yes, of course. But if you combine it in the lips, it's like sometimes like surprisingly
Which
bad.
product you use? Which Juvederm you use for the lips?
Вы когда-нибудь работаете с жуведермом? Тройкой? Тройкой работает?
They use or not?
3 and Smile they use some of.
I don't know Smile because there is no Smile in Turkey. I used before when I was in Turkey. I use wall lift.
I used 3.
3 is
Quite often I used
3 is a little bit hard for the lips. I find it.
Yeah, well, we did use it, but then it started to swell like.
Exactly, swelling and hard. I find it. Wall lift is softer. I find more natural result. Yep. It's coming. One needle. One more time. I don't know. Maybe she understand or not.
Вы понимаете английский? Нет, she cannot understand.
Tell the patient when you do it.
Это к лучшему, потому что они на медицинские термины.
For opening.
Под
You,
углом я делаю прокол здесь.
you don't need to go to until the deep, no.
Глубоко не
No.
надо. но
Just
вот-
pass through the dermis.
She is not doing that perpendicularly. Вообще, когда вы делаете
It's
прокол-
okay, you can do this way, but till the dermis. Here you don't need to do perpendicular, but here you need to do, because you have to go till the bone. You have to do this. But here you don't need.
И если вы планируете менять направление канюли потом в противоположное, тогда лучше, если перпендикулярно. А если вы только в этом направлении работаете, тогда лучше направляйте.
Да, ну вот я раньше делала всегда под
Because
углом
if you
40
do like
градусов
this,
получается.
Хорошо.
if you open it like this here, like here, you cannot go till the bone, then you cannot find the interfacial.
Это важно только на лбу, потому что нам нужно достичь глубокого.
Теперь здесь, получается, мы работаем не на надкоснице, а в зоне именно глубоких жировых пакетов. Правильно я
Ну, это
понимаю?
почти надкосница, то есть это они прям плотно прилегают к надкоснице, поэтому надкосница это наша цель. Потому что только
То есть
поняв,
мне
где
всё-таки
надкосница,
стоит дойти до надкосницы.
ну, да, ну как бы вы ее просто ощущаете, да, что она вот углом.
То есть я углубляюсь и делаю разворот. Вот я сейчас легко иду.
She's easy now sliding.
Mm-hmm. Everything is correct, yep.
Все
У
правильно.
меня не будет миграции препарата в этом случае.
Will she's afraid that it will migrate
No.
the filler.
If your medial SUV, it's closed compartment, your product cannot migrate. Impossible.
Если вы четко в
If you
этом...
inject, for example, Bishafet, yes, it can migrate because it's like it's in the air. There is no limitations, bones or something. But SUV or deep medial cheek, it's closed
Ограниченный,
compartment.
да, получается?
Да, но это
It's like
сумочка.
room.
Да.
Это как комната, которую вы заполняете. Если вы в него попали, то там и
So
останетесь.
it's not SUV.
Not SUV.
Now, where is your tip of cannula? No.
Он медиально должен
Look,
стоять.
where are you?
Окей.
You're medial to the mid-pupillary line. This is the area, there is no fat tissue. This is the tear trough area. Come. Give me. Here is the medial SUV. You shouldn't see your tip of cannula. Okay?
То есть
If you
я
see
иду
your cannula,
не медиальнее, а
it's in the tear trough
Ну,
area.
это
There is no
практически
fat
центральная
tissue.
часть.
центральная часть.
Да, то есть
А.
не медиальные среднезрачковые линии.
Now is correct.
Меня интересует глубина. Правильно ли я
The
взяла?
depth, now
Depth
she
is good.
ощущает-
Depth
Да?
is good.
То есть вот получается,
deep.
я не
Мгм.
поверхностно, я в глубоком живом пакете, да?
Да, но это под мышцей,
Под
грубо
мышцей.
говоря, да.
Угу. Все, нужен препарат.
Yeah. Slow injections always. Give a small volume.
И на реакцию, когда вы смотрите, да, первая капля всегда говорит вам о том, что нет рядом сосудистого либо риска.
Получается, сейчас вот сюда я выложить не могу препарат. Да?
Куда вот сюда?
Медиальный. Вот в эту часть. Вот где именно борозда получается у нас.
А зачем?
Нет?
Борозда – это поверхностное
Поверхностное,
образование.
да.
Мы сейчас поднимаем саму щеку, выталкиваем ее
всё.
вперед. Мы придем сейчас к поверхностному пакету, это когда мы будем работать в поверхностных жировых пакетах.
Хорошо.
She wants to correct the sulcus by being inside, and I explained that it's better to
Artery,
finish.
vein,
Yeah.
inside the sulcus. If there is a sulcus on the face, it's the way of the
Vein.
veins or arteries. You can, yes, but first support
Deep,
the deep
yeah.
tissues, then support the superficial fat, then check the sulcus. Last options. It's good. How much you gave?
Мы же так не будем больше, только первую минуту прожить.
Примерно
It's enough. 0.3 you gave it. So change your direction, come here and here. But how we could do it? the organization is problem. I cannot do everything.
How many you think?
No, I don't know. The main idea
Is to show.
exactly. So the model, if it's higher, it doesn't mean the good quality.
I agree.
Yes.
This one.
Mm-hmm.
Ну, сейчас вот он объяснит, и мы перейдем ко второй. Давайте просто будем по факту двигаться и все. Потому что когда быстро это просто...
Then we can do something like that. With the temple, exactly. I cannot do full face.
No, full face only one.
Okay, then,
And then
only one zone.
everyone is the
Exactly,
most important
exactly.
zone.
Then is okay. Then we can speed up. Full face we cannot.
И тоже может быть, знаете, хорошая идея, когда сам доктор хочет
Good.
попробовать какую-то
How
зону.
much you give?
Да, потому что не full face. Если он работает уже этой техникой, они могут это сделать впоследствии сами.
Okay, the half.
Продвинуть
Okay,
доктора.
I think 0.6 is enough. 0.6.
И когда
So,
доктор
make
его модель
superficial injections.
отдельно от пациента,
This is the deep.
спросите, какую зону
You wanna give more
конкретно
here?
хочет отработать.
You can a little bit.
Потому что ты же докторов будешь. Имя. Okay. I recommend that the doctors will choose the zone that they want to try.
Exactly.
Because it's more for doctors than for
Okay,
models.
doctors?
Yeah.
Doctors should choose
Yeah, because
the
for example,
model.
they are not safe.
Yeah, I think, yeah, go. Let's check. I think doctors can check the models. They can choose their own models, zones.
С моделью своей подходите, вы говорите, я бы хотела вот
Perfect.
откорректировать вот эту зону. Как бы вы это сделали? Вот так, да, вы имеете в виду?
Да.
Да, вот он
forget.
рекомендует, получается, рекомендует, вы говорите
Almost
свое
half.
мнение, он говорит свое,
Deep.
но не все лицо.
Half here, then you will the same amount other side. The other half is here, other half here.
Okay. На всех остальных мы знаем.
Now here.
Yes, everyone agreed with your idea.
Good.
Оксана Анатольевна, вы мне скажите, когда я уже...
Сам доктор пускай приглашает свою модель.
You open your way this direction.
Поверхностно.
If you open this direction with your guide needle, your cannula go this direction.
Теперь она смещается, сейчас латеральный отдел, где связочный аппарат, она будет корректировать глубоко, и подскуловая зона тоже. И потом здесь прям full face,
No.
просто заигрываем, грубо говоря, желательно придать форму, потому что вообще не
Как дела?
идеально для головного.
Она липодистрофирует, потому что
Yes. Retrograde.
Хорошо
Perfect.
даст длительную коррекцию.
Super.
Когда мы на оригинал обсуждали, допустим, там была научная работа, когда мы вводим длительного расположения вот эти наполнители, они стимулируют рост жировой ткани. И в данном случае это такая прям терапия реально. Хорошо работает. И вот единственное, если, допустим, мы говорим про дистрофию, например, при гипостериозе, когда компенсированное состояние, но при этом остался вот результат работы щитовидной железы, там, конечно, мягче наполнитель надо использовать, они очень плохо распределяются, прям слои прям просто слеплены. Вообще отсутствует соединительная, только соединительная ткань присутствует. Там мягче мы наполняем, но здесь нормально. Четверка здесь будет хорошо давать коррекцию, до 2,5 лет. Нет, тогда можно с бойкой делать. Можно даже делать биоэкспандер или RC1, что-то воды, что даст, что раздвинет слои. Просто здесь это будет медленная коррекция, в течение 2 лет у пациента будет нарастание.
Finish. You can give a little bit here.
Да, и компрессии, то есть, и вот этого тиндаля нужно. Может, тиндалить и на лице у некоторых пациентов при тонкой коже, но такие оттенок
Finished? You have A little bit more. Хорошо.
Хорошо.
Then,
It's a beautiful model.
exactly.
Сразу, я говорю, вы очень хорошо подходите. Это корректно, сразу будет такое перевоплощение лица.
Также пациентка ни разу не делала филлеры, full face, не делала нити, и у нее нет фиброзы, и поэтому очень легко
So,
делать канюлю.
it's good. So, what is plan? Now, I think my plan, the next step, we can open from here. We can also fill marionette. You can also fill a little bit pre-jaw, the same entry point. You can fill like this. You can fill here. You can fill a little bit. That's a beautiful. Okay. Chitiri again. The important entry points. You check your canada. For example, this is dirty. I can show it. When you enter from here, like check. Okay, I can reach here. I can reach here. I can also reach here. It's good. You can open around here.
Когда вводим канюлю, вот здесь вот надо закончить, да, введение, то есть сюда же мы не можем вводить, потому что он...
Ну, желательно не оставлять там, да. Но по каналу он может немножко двигаться все равно, но это не страшно. Например, she is afraid that some filler will end up in this heavy line.
Don't push there.
Да. Просто не
Come
нажимайте.
here and stop giving here. Don't give your product here. You can control it. Good.
Препарат немного. How much did you use for the...
Here, one syringe.
Один шприц они использовали на медиальную часть.
1.2, it has 0.6 deep fats and 0.6 here superficially.
Очень красивый результат, вам вот так видно, да, сверху? Потому что прям заваленная медиальная
So,
артерия.
do superficial. No, don't go deep. No, it's deep. Don't go deep. Stay superficial. Okay? You can stretch. I can help.
Когда вот your favorite product you said is?
Ultra 4, 2.
У него любимый препарат двойка и четверка, у меня самый любимый это
2,
четверка.
4. 2, 4.
Я больше всего четверку использую. Я знаю, что вы ультрадип.
Then press a little bit. She has pain. Just a
После
little bit
H4, мне
press.
кажется, ничем не заменить. Его можно
Then wait,
везде
because it's
просто
lidocaine
делать.
inside. Okay? Okay.
Ее вот, если полюбить четверку,
Yeah,
если
you
её
can inject a little
невозможно
bit.
на рынке
She
заменить.
doesn't need too much. She
Поскольку
doesn't have
вот
deep.
в поверхностных слоях она дает
Подбородочный.
It's not deep,
который
so she
без
doesn't need
точности
too
по
much here.
сложности, он дает
She need
вот
more
эту
here.
волюмизацию,
Yeah.
такую,
No
которую
deep.
тебе нужно.
Don't inject
Ультрадип,
here.
он будет прорисовываться в любом
So-
случае, как бы он будет на каком-то уровне отеки. Я имею в виду поверхностных слоях.
Good.
А я, конечно, он
Да, я буду только на вкус листа.
Okay.
иглой и
Inject.
канюля.
Канюли я чаще всего. Ну, подбородок у меня так.
Don't do this.
Наполовину.
Да,
You don't need to do like this. You don't need to do like this. Just linear.
четверка.
Every time you touch the skin with your cannula, you contaminate it. Then when you put it inside, then the high risk for infection. Check your cannula. Don't touch the skin.
Сейчас план коррекции это периоральная область полностью, вся, весь подбородочный поверхностный жировой пакет. Потому что он планирует идти вверх
Enough.
и планирует идти вниз,
Come,
и
for
планирует
example.
идти на мандибулярную связку. И он показывал, когда канюлю он ставит, он
This line,
смотрит,
so
чтобы он
come
везде
really
мог достать
superficially.
канал.
Just inject. Look.
Little.
Это, конечно,
Exactly.
любимый тип модели для
Just small
филлера.
amount. Okay. Done. You can come.
Не видно, вы
You
сделали.
can come.
А здесь
Pre-jolt area.
идеально. Как цветочек сейчас распустится.
You can inject pre-jolt area. Just I give small amounts.
Вот смотрите, канюлей поднимаем мандибулярную зону, да, мандибулярную связку. В основном же иглой рекомендуется часто. Мы смотрим как бы на видео от спикера.
Okay, done.
Это болюс, да, там.
You can change your direction
Я вот канюлей тоже делаю, в смысле, эту
and
зону.
come really superficial. You see how superficial I am? You can inject this fold.
I love how you do the wall with your hand from another side. Да, с обратной стороны это надо приноровиться.
Okay. So we can give a little bit more volume like here. Let's see.
1 миллилитр, да, ушел?
Так, 0,3 у нас осталось
А
еще.
0,9 ушло на коррекцию периодального образа.
So we check. You see?
0,9. С одной стороны у нас ушло 2 миллилитра.
How much we have? More?
0,3.
You can give a little bit here, huh? Here is also empty a little bit. How you do? No, you can use the same entry point.
Окей.
Давайте я пущу.
It's empty face. Huh?
Yeah. But that's why it will be the perfect result.
But it's also hard.
Yeah.
If it's empty, if you do wrong, then you can see it. It's also not easy. When there is more tissue, it's hard to make
Hide it.
wrong.
Yeah.
Like breast implants. There is no tissue, there is no breast like a man. If you put it wrong implant, wrong layer, wrong position, you can see immediately.
Even a small mistake is visible.
Exactly. Even the nose. If the tissue is thin, after rhinoplasty, you can see the irregularities, everything. But the skin is thick, and also if it's a little bit breast, it's hard to see your wrongs. It's hide it.
Если мы можем приводить, то
Are you finished with the correction of that moment? I think it will be beautiful. The center
Can
of
we-
the superficial
Let's
of
see
the
when.
chin.
Yes,
Yeah?
just a deep injections, not just this.
Just to give it like the heart shape. Yeah.
Curve. Let's do. Okay, do with this with the needle. Let's see, huh?
Needle.
Don't open new one.
Не надо открывать
иглой.
новый, вот этот возьмите
Or
и
Canada.
иголочкой в центре. Или
я-
канюли, если хотите.
You can do with
Я
Canada.
Я
иглой
использую
делаю.
канюлю.
Do just the
Доктор
here.
говорит, иглу возьмите. Попробуйте, если вы иглой не пробовали, попробуйте.
Нет, я иглой наоборот делаю.
Тогда канюлю попробуйте.
Let's do it here. Then
Просто у меня подбородок имеет
we
вес
check
иглы.
in the when she after that she sits. We checked. Do here. You want to do with Canada?
Он просто даст вот такую девочку. Изображение, она узкая. Сейчас
Can
вот
we
и тройка
reach
у него.
there?
Тройкой?
Да, это просто подкожный жировой пакет, то, что осталось просто открытым у него.
Yes, I'm there. You don't need a new hole.
You're superficial, yeah?
Yes.
Yeah. Он на мышце, то есть не под мышцей. У нее объем хороший, то есть по всем линиям
Do it.
и звуковой
Come here,
проекции
just make
он
this
достаточно
curve.
твердый, просто форма.
Just fill here.
Такая.
I
Чуть-чуть
correct,
её как бы
I
собрать.
correct the
Там
needle
чуть-чуть
with
еще
needle.
утрирую.
No, do it with this.
Окей.
You have.
Там сколько у вас осталось?
Yeah, you can do with needle, but we have cannula. We have
But
hole.
she knows how to do that.
Yes, with a needle.
She wants to try it.
Yeah, exactly. Try it. Count.
Нет, там 0,5 нет, по-моему. 0,5?
0,5, да, 0,5.
Come to the here. Feel with your finger. Where are you? Then fill it.
Кладем, рычить рука не будет расплываться.
Там надо, чтобы она чуть-чуть, если прям в центр поставить, она раскрывется, и она даст вот эту круглую форму подбородка. Потому что сейчас он такой, как двойной, ну, даже не уплощенный, он немножко втянутый даже. Поэтому он дает такое мужское изображение подбородка, хоть и маленькое. Если сделать...
If you inject deep here, you can just project the chin. You cannot correct this
shape.
exactly. The shape corrections, you need superficial injections. And this area, superficial injections, it's better to do with Canada. Superficial with needle is quite dangerous in the tip of the chin, okay? Perfect. Just a little bit here. Yes, perfect.
Тройка вообще подкожная, она очень красивая. То есть, если, например, вы выбираете между четверкой и тройкой, и вот в таком лице, например, мы боимся, как доктор сказал сейчас, что с таким лицом красиво будет результат, но и получить осложнение легче. Потому что если вы что-то делаете как по типу гиперкоррекции или положите чуть больше, будет видно то, что на отеке она увидит все свои, ну там, где что лежит и так далее. Поэтому, если поставить руку хотеть на то, чтобы работать именно по всему слою,
Give all. Give inject everything.
отрабатываем технику, потом переходим на водоплавание. Также есть лицо. Тройка будет хорошо там.
Finished.
And you wanted to show the shape of the lips, right? Or it's later?
I think we continue with other patient, huh?
Okay.
Look here. What she need more? I cannot see. Okay, now so let me fold better. Marionette fold better. And look at this side. Square. It's V shape. Can you see it? And it's more visible, less visible. Its mouth, it's up, it's more down. You see? I like it.
Виктория, переведите, пожалуйста, здесь я немножко задела венку и образовался синячок. И у меня теперь отек. Отек, да. И ушло у меня немножко меньше препарата.
How much?
Получается, у меня ушло.
Did you give 0.5? Richard 3?
No,
Less volume.
Okay, then it's okay.
1 point.
Okay, if it's hematoma and if you cannot see the results because of the hematoma, just press, then wait 2 weeks after resolution. If it's asymmetry, then you inject one more time. Not now. Just let it.
Поняла.
Да, я поняла. Через 2 недели сделать коррекцию, да, когда пройдет гематома?
Если вдруг.
Да.
Если что.
Окей. Спасибо.
Then we wait. Press. She need a little bit here volume, this side, here. You see? Here more, here less.
4 or 3.
You did give here?
No.
Not yet.
Not.
Okay, then do it later. She will do. Two. 1 syringe. Canada, 25.
25.